Today we're going to prime an IV line and connect it to a patient. So to begin with, I need to make sure I've got a scenario that corresponds with an IV chart. So this is for Jessica Fong. She needs an IV line for antibiotic therapy, and I've just checked that I have actually got Jessica Fong's IV order. Later on I will check her ID to her at the bed. So I can see here I've got an IV needed. It's dated for today. It's 0.9% sodium chloride. So I'm just going to get ready for that. First of all, I'm going to clean down my trolley because I need to have a clean surface to work on. There we go. So just give it a quick clean, get all the muck off. And actually I'm going to also just make sure my pole's clean too, because it can get a lot of splash on it and it goes between patients. Okay, now equipment. I don't really need a sharp spindle to take with me. I'll need gloves, hand wash, and I'll give my hand a bit of a wash now. And I've got my IV order, fluid, my burette, and my line. Okay, so this gets primed and then taken to the patient, so we're not actually in the patient's room. I'll get this checked with another RN. So here I have Jessica Fong. It's an IV order. It's flask number 1. It's 0.9% sodium chloride. It's to run over 12 hours. 1,000 mils, ordered by Dr. Smith. You can see here I have 0.9% sodium chloride. Same as that, 1,000 mils, and it's actually in date. It says January or June, can't see it, but 2016. And if I was to look at it, the bag's intact and there doesn't seem to be any contaminants. Okay, got my burette and my line, which is just a gravity line. This line is 20 drops per mil giving set, so I'll use that in my calculation. Okay, so I washed my hands previously. I'll rip my bag open, and when I open up the line and the burette, I'm not just going to toss it onto the trolley. I'll leave it sitting there in its sterile package. Alright. The first thing I'm going to do is make sure all my roller clamps are off. I will start by connecting the flask to the burette. So you twist the cap off. Do not touch anything that had a cap on it prior. That would be contaminating it. And be very careful puncturing the flask. You don't want to go through the side of it and end up puncturing yourself. Okay, I will hang that now. Okay, this end of the burette's still got a cap on it, so it can't be contaminated. When I pick up the IV line, I do not undo it. I can hold it in my hand, or if I rip the paper tape off, I still hold it in my hand. I don't drop it. Once again, not touching the spike. And give it a bit of a twist. Okay. Right, now we're ready to start filling with fluid. Starting at the top. Open up the roller clamp to the burette, and I'll fill it up to about 100 mils because that gives me a bit of room to prime the line. Turn the roller clamp off. Next we have to prime the drip chamber by giving it a couple of squeezes. Do not squeeze the burette because eventually that will crack and then you'll have spillage. Squeeze the drip chamber to about half full. Now I need to prime into something. You do not prime into the bed or onto the floor. You prime into a sink or into a bucket or into a bin. But again, you do not drop the end of the IV line into that receptacle. So I will hold it. So I'll just turn it on to let the fluid run down the line. And be patient. Okay, it's to the end. Notice I did not take the cap off. There's no need to take that cap off. If you take the cap off, you potentially can contaminate. I've got a little bubble, so I'll just keep it running for a minute, just to get that bubble out. Be patient. Good, it's nearly there. All right, now I'll continue. So I haven't let go of the end. I'm going to coil the IV line up, just hook it up onto the IV pole so everything is protected. All right. Now I will go to the patient. Take my hand wash with me. As I am going to enter the patient's room, I will be washing my hands. And I will get the nurse to come with me, please.
Sure.
Hi Jessica. I'm Heather, I'm your nurse today. You've got to have some IV antibiotics through your IV cannula, so I'm going to connect up the IV line with the fluid to the cannula. It's been ordered by the doctor. Have you had this done before?
Yes.
Okay, so you know that this IV flask will continue running until it's finished and I will monitor it. And we'll give the antibiotics later on. Are you okay if I proceed with this?
Yes.
I'm just going to check your ID band with the nurse. So we have Jessica Fong, date of birth 11th of the 1st, 55. You are 233912. Are you allergic to anything, Jessica?
Not that I know of.
Great. Okay, so now I will connect it up. Before I start though, I just need to check your IV cannula and the IV site to make sure it looks okay. So I'm just going to put gloves on because that will protect me from any contaminants such as body fluids. Okay. Here we go. How does that feel, Jessica? Have you got any pain?
It's not sore at all.
It looks good. There's no bleeding, no exudate, no fluid, and it doesn't look red or hot or feel hot. Okay, so I'll go ahead with that. Here we go. So I'll just make sure it's turned off to the patient, which means that the three-way tap, the side with no little wing to it, is off, so it's off to the cannula. And I'll unscrew the cap. I would replace that with a new cap when I'm finished. Give it a good swab and allow 30 seconds for it to dry. Great. Whilst it's drying, I'll just get my line ready. Oops. This line's still got a cap on it. Managed to tangle it, that's okay. Good. Right. Here we go. It's Luer lock, so I push it in and give it a gentle turning action. And now I will turn the line on. So wherever these wings are facing is on. Great. Now I will take my gloves off. Okay, now I've done a calculation. I've got 0.9% sodium chloride for 12 hours, so it's 1,000 mils divided by 12 times 20, because it's a 20 drop per mil drip chamber, over 60. So 1,000 divided by 12 times 20 over 60. So I know that it'll be dripping at 28 drops per minute. So I will start. Here we go. I might hang your burette up a little bit higher so I get better pull of gravity. When I hang the burette up, make sure that I can read the numbers. And do not turn the burette upside down, you'll only get air down the line. So I'll put that up here like that. And here we go. I've got my watch. And again, be patient. Okay. So a little bit slower. There we go. So I counted it for 15 seconds. I can come back and count it for a full minute to make sure it is at the right rate. How are you feeling, Jessica? I will be back to check on you in 15 minutes. I'll just go and do my paperwork and tidy up. I'll also anchor the IV tubing further up the arm so there's no pulling on the actual cannula. When I go to do my paperwork, I need to sign the date, which is the 15th of the 12th, the time, which is 2 o'clock, I sign, and the nurse who checked the IV flask with me will also sign, and I also have to document it in the progress notes. If there was any adverse reactions or inadvertent things happened, I put it in the progress notes, but otherwise we're okay. And I need to clean up all my rubbish. There is no sharps, but I'll put all my rubbish away.